7 personal hygiene mistakes elderly make that doctors notice immediately. Number 4 is shocking. Hello, my dear friends, and welcome back to our channel, where we share practical wisdom for living a healthy, joyful, and fulfilling life in our golden years. I'm Dr. James, your friendly guide to aging gracefully, and today we're diving into a topic that's close to my heart, and honestly, one that can make a huge difference in how you feel every single day. It's about personal hygiene. Now, I know what you might be thinking. Dr. James, I've been taking care of myself for decades. I've got this covered. And I hear you. But as a doctor who's worked with countless seniors over the years, I've seen some common hygiene mistakes that even the most careful among us can make. Mistakes that doctors notice right away and that can affect your health confidence and even how others perceive you. Today, we're going to talk about 7 personal hygiene mistakes elderly make that doctors notice immediately. And trust me, number 4 is going to surprise you. These are things I've seen in my practice, and I'm sharing them not to point fingers, but to help you feel your absolute best. After all, good hygiene isn't just about looking clean. It's about staying healthy, boosting your mood, and showing the world that you're thriving in your later years. So, grab a cup of tea, get comfortable, and let's dive in with an open mind. By the end of this video, you'll have practical tips to make small changes that can lead to big results. Let's get started. Mistake number 1, skipping regular showers or baths. Let's start with something that might seem obvious but can slip through the cracks, not showering or bathing as often as needed. Now, I get it. Sometimes getting into the shower can feel like a chore, especially if you're dealing with arthritis, mobility issues, or just low energy. I had a patient, Mary, a lovely 72-year-old, who admitted to me that she'd sometimes go 3 or 4 days without a full shower because it was just too much effort. She'd freshen up with a washcloth, but it wasn't the same. Over time, she started noticing skin irritations, and her doctor, yours truly, noticed an odor that was starting to affect her confidence. Here's why this matters. As we age, our skin produces less oil, which can make it drier and more prone to infections if not cleaned properly. Plus, sweat and bacteria can build up, leading to rashes or even urinary tract infections if hygiene isn't maintained. Doctors notice this right away because it can show up as redness, irritation, or even a faint smell that lingers. What to do instead? Aim to shower or bathe at least every other day, or daily if you're active. If mobility is an issue, consider a shower chair or handheld showerhead. They're game changers. And if you're worried about dry skin, use a gentle, fragrance-free moisturizing soap and apply a good lotion afterward. It's a small step that can make you feel refreshed and keep your skin healthy. Mistake number 2, neglecting oral hygiene. Next up is one that's so easy to overlook, oral hygiene. I can't tell you how many times I've sat down with a patient and noticed that their breath or teeth gave away that they weren't brushing or flossing as often as they should. Take my patient, Tom, a 68-year-old retired teacher. Tom was proud of his smile, but he admitted he'd gotten lax about brushing twice a day because his hands weren't as steady, and flossing felt like a hassle. Over time, his gums started bleeding, and he developed bad breath that made him self-conscious during social gatherings. Poor oral hygiene doesn't just affect your smile. It's linked to serious health issues like heart disease and diabetes complications. As we age, our saliva production decreases, which makes it easier for bacteria to grow in the mouth. Doctors notice this immediately because bad breath or inflamed gums are hard to miss during a checkup. What to do instead? Brush twice a day with a soft bristled toothbrush, and don't skip flossing, even if it's just once a day. If dexterity is an issue, try an electric toothbrush or floss picks, which are easier to handle. And don't forget to visit your dentist at least once a year. A healthy mouth is a gateway to a healthy body, and it'll keep your smile shining bright. Mistake number 3, forgetting to clean under nails. This one might sound minor, but it's a big deal. Not cleaning under your fingernails and toenails. I remember a patient, Susan, who came in with a painful infection under her toenail. She was meticulous about her appearance, but she hadn't realized how dirt and bacteria can build up under nails, especially if they're not trimmed or cleaned regularly. Doctors notice this right away because long, unkempt nails can harbor germs that lead to infections, especially in seniors with weaker immune systems. Nail hygiene is crucial because bacteria like MRSA can hide under nails and cause serious problems, especially if you have cuts or sores. Plus, clean nails just make you feel polished and put together. What to do instead? Trim your nails regularly. Stray across for toenails to prevent ingrown nails, and use a nail brush or washcloth to clean underneath. If you have trouble reaching your feet, ask a family member or consider a podiatrist visit every few months. It's a small habit that goes a long way. Mistake number 4, using harsh soaps or overwashing sensitive areas, the shocking one. All right, here's the one I promise would shock you. Using harsh soaps or overwashing sensitive areas, especially around private areas. I had a patient, Linda, who was so diligent about staying clean that she used strong antibacterial soap multiple times a day on her genital area. She thought she was doing the right thing, but she ended up with chronic irritation and even a yeast infection because the soap stripped away her skin's natural protective oils. When she came to me, I could tell right away that her hygiene routine was doing more harm than good. This is shocking because many of us grew up believing that more soap equals cleaner, but that's not true, especially as we age. Harsh soaps can disrupt the skin's pH balance, leading to dryness, irritation, and infections. Doctors notice this immediately because it shows up as redness, itching, or discomfort that patients often don't connect to their hygiene habits. What to do instead? Stick to mild, fragrance-free soaps for sensitive areas, and only wash those areas once a day unless advised otherwise by a doctor. Your body has a natural balance, and gentle cleansing is usually enough. If you're noticing irritation, talk to your doctor. They might recommend a specific cleanser or cream to soothe the area. Mistake number 5, ignoring foot care. Let's talk about your feet. Yes, those hard-working parts of your body that deserve more love than they often get. I've seen so many seniors, like my patient Robert, neglect their feet because they're out of sight, out of mind. Robert came in with cracked, dry heels and a fungal infection between his toes because he wasn't washing or moisturizing his feet regularly. Doctors notice foot issues right away because they can lead to pain, infections, or even mobility problems. As we age, our feet can become drier, and poor circulation can make infections harder to fight off. Plus, if you have diabetes, foot care is critical to prevent complications. What to do instead? Wash your feet daily, making sure to clean between the toes and dry them thoroughly to prevent fungal growth. Apply a thick moisturizer, like one with urea or glycerin, to keep heels soft. And if you can't reach your feet easily, a long-handled sponge or a visit to a podiatrist can work wonders. Your feet carry you through life. Treat them with care. Mistake number 6, not changing clothes or bedding often enough. This one might catch you by surprise. Not changing your clothes or bedding as often as needed. I had a patient, Margaret, who loved her cozy flannel pajamas and would wear them for several days in a row to save on laundry. She didn't realize that sweat and skin cells were building up, leading to body odor and skin irritation. Similarly, bedding that's not washed weekly can harbor dust mites and bacteria, which can trigger allergies or skin issues. Doctors notice this because it can show up as a faint odor or skin problems that don't seem to have an obvious cause. Plus, clean clothes and sheets just make you feel fresh and ready to take on the day. What to do instead? Change your clothes daily, especially undergarments and socks, and wash bedding at least once a week in hot water. If laundry feels overwhelming, consider simplifying your wardrobe or asking for help from a family member. It's a small change that can boost your comfort and confidence. Mistake number 7, overlooking ear hygiene. Last but not least, let's talk about your ears. I've seen patients like John, a 75-year-old who thought cleaning his ears meant digging in with a cotton swab every day. Not only was he pushing wax deeper into his ear canal, but he also caused irritation that led to an infection. Doctors notice ear issues right away because wax buildup or redness can affect hearing and comfort. As we age, earwax can become drier and harder, making it tempting to clean with swabs, but this can do more harm than good. Proper ear hygiene is about balance, not too much cleaning, but not ignoring it either. What to do instead? Clean the outer part of your ears with a washcloth during your shower, and avoid sticking anything inside the ear canal. If you're noticing wax buildup or hearing changes, see a doctor. They can safely remove excess wax. Your ears will thank you, and you'll hear the world a little clearer. Well, there you have it, my friends. 7 personal hygiene mistakes that doctors notice right away, and how you can avoid them to feel your very best. I know talking about hygiene can feel a little personal, but I share these tips because I care about you and want you to live your golden years with confidence, health, and joy. Whether it's taking that extra moment to brush your teeth, switching to a gentler soap, or giving your feet some love, these small changes can make a big difference in how you look and feel. I hope you found this video helpful, and if you did, please give a thumbs up, share it with a friend, and hit that subscribe button so we can keep bringing you practical wisdom for healthy aging. I'd love to hear from you in the comments. What's one hygiene tip you're going to try this week? Or maybe you have a story about how a small change made a big impact in your life. Let's inspire each other. Until next time, keep shining, keep smiling, and remember, you're never too old to live your best life. This is Dr. James, signing off with love and gratitude. See you soon.